This video is a complete guide to the Integrated Child Development Services, or ICDS, crucial for nursing exams like NORCET, RRB, ESIC, and DHS. ICDS was launched on October 2, 1975, coinciding with Mahatma Gandhi's 106th birthday. It operates under the Ministry of Women and Child Development and is the world's largest community-based early childhood development program. The objectives of ICDS are focused on improving the nutritional and health status of children from birth to 6 years. It also aims to lay the foundation for proper psychological, physical, and social development, reducing mortality, morbidity, and school dropout rates. The primary beneficiaries are children aged 0 to 6 years, pregnant women, and lactating mothers. Other groups include adolescent girls, aged 11 to 18, under the Scheme for Adolescent Girls, and women aged 15 to 45 years for nutrition and health education. ICDS delivers 6 services: supplementary nutrition, immunization, health checkup, referral services, non-formal preschool education, and nutrition and health education. Let's quickly check your knowledge. ICDS was launched in 1975 on October 2nd. The ministry controlling ICDS is the Ministry of Women and Child Development. The Supplementary Nutrition Program, or SNP, bridges the gap between recommended and actual dietary intake. Support is provided for 300 days a year, either as take-home rations for children under 3 or hot-cooked meals for children aged 3 to 6. Immunization services are crucial. The Anganwadi worker assists with beneficiary surveys and mobilization, while the auxiliary nurse midwife, or ANM, and the health system administer vaccines following the national immunization schedule. Health checkups include antenatal and postnatal care, growth monitoring, and management of minor ailments. Sick or severely malnourished children are provided referral services to higher-level facilities, such as nutrition rehabilitation centers. Non-formal preschool education, considered the backbone of ICDS, targets children aged 3 to 6 years. The focus is on joyful learning, play, and creative activities to prepare them for primary schooling. Nutrition and health education targets women aged 15 to 45 years. The aim is to build their capacity to look after their own and their family's health, covering topics like breastfeeding, hygiene, and family planning. Preschool education in ICDS is provided to children of the 3 to 6 years age group. The Anganwadi Center, meaning courtyard shelter, is the focal point for ICDS service delivery. It is staffed by an Anganwadi worker, an honorary worker, and an Anganwadi helper. The Anganwadi workers' responsibilities include community surveys, growth monitoring, organizing supplementary nutrition, providing preschool education, and assisting the ANM in immunization activities. Population norms for an Anganwadi center typically range from 400 to 800 people in plain areas and 300 to 800 in tribal, hilly, and desert areas. An Anganwadi worker covers a population of approximately 400 to 800 people in plain areas. The administrative structure involves the Child Development Project Officer, or CDPO, at the block level, who is the key administrator. The Mukhya Sevika supervises the Anganwadi workers. Revised nutritional norms mandate that a normal child receives 500 kilocalories and 12 to 15 grams of protein, while a severely malnourished child receives 800 kilocalories and 20 to 25 grams of protein. A severely malnourished child in ICDS is provided 20 to 25 grams of protein. The Mukhya Sevika, or supervisor, supervises the Anganwadi worker. Growth monitoring uses WHO child growth standards, where the AWW plots weight for age monthly. Color coding indicates the status: green for normal, yellow for moderately underweight, and orange or red for severely underweight. Poshan Abhiyan, launched in March 2018, aims to reduce stunting and undernutrition by 2% annually, anemia by 3% annually, and low birth weight by 2% annually. Rashtriya Poshan Ma, or National Nutrition Month, is celebrated every year in September. Poshan Pakhwada, a nutrition fortnight, is usually celebrated in March. PMMVY, or Pradhan Mantri Matru Vandana Yojana, provides a cash incentive of 5,000 rupees in 3 installments to pregnant women and lactating mothers for the first living child. ICDS now uses a rapid reporting system with the Poshan Tracker app, replacing paper registers and ICDS CAS. Anganwadi workers use smartphones for real-time data entry, including daily center opening and growth monitoring. As per revised ICDS norms, the energy provided to a pregnant or lactating mother is 600 kilocalories. The beneficiary groups for ICDS are children 0 to 6 years, pregnant women, and lactating mothers. Women aged 15 to 45 years are not beneficiaries for supplementary nutrition unless pregnant or lactating, but they are targeted for nutrition and health education. The Integrated Child Development Services Scheme was launched on October 2, 1975. The auxiliary nurse midwife, or ANM, plays a vital role in ICDS by conducting health checkups and immunization at the Anganwadi Center. They also refer high-risk cases and distribute iron and folic acid tablets. Key points to remember are: the Anganwadi Center is the heart of ICDS, and preschool education is its backbone. Poshan Ma is in September, and severely malnourished children receive 800 kilocalories and 20 to 25 grams of protein. An ICDS project typically corresponds to a community development block covering rural, tribal, and urban areas. The scheme for adolescent girls, formerly SABLA, targets out-of-school girls aged 11 to 14 years. They receive 600 kilocalories and 18 to 20 grams of protein, along with health checkups and skill training. CDPO stands for Child Development Project Officer. Village Health Nutrition Day, or VHND, is usually conducted on Wednesdays or Thursdays. Job aids for the Anganwadi worker include weighing scales, growth charts, MUAC tape, medicine kits, and preschool education kits. In ICDS, the term Anganwadi literally translates to courtyard shelter. The protein requirement for a normal child aged 6 months to 3 years under ICDS supplementary nutrition is 12 to 15 grams. ICDS, launched in 1975, is the flagship program for early childhood care. It delivers 6 integrated services through the Anganwadi worker and is strengthened by Poshan Abhiyan and the Poshan Tracker app. Thank you for watching this video. Keep learning and growing, and all the best for your upcoming exams. You can connect with the author, Mr. Nagesh Sir, pediatric and community health nursing expert, via WhatsApp or Gmail for further information.